Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pneumocystis infections. Introduction. Pneumocystis infections are caused by a certain type of fungus. The fungus is known as Pneumocystis urivec. It lives in the lungs of many people. Most people's immune systems keep the fungus under control, but if your immune system is weak, the fungus can make you very sick. This program focuses on Pneumocystis pneumonia, the most common and serious type of pneumocystis infection. It discusses symptoms, causes, treatment, and prevention. Pneumocystis infections. Pneumocystis urivec is a tiny fungus that lives in the lungs of many people. Fungi are plant-like organisms. Mushrooms, yeasts, and molds are examples of fungi. Most people's immune systems keep the fungus under control. The immune system is a group of organs and cells in the body. They protect and defend the body against infections and diseases. If your immune system is weak, the fungus can make you very sick. It can cause pneumocystis infections. Pneumocystis pneumonia is the most common type of pneumocystis infection. It is also known as PCP. PCP happens to people with weak immune systems. Researchers are not yet sure how people get PCP. Studies have shown that many people are exposed to the fungus as children, but they do not get sick because their immune systems are strong. Usually pneumocystis infections only happen in the lungs, but sometimes they can spread to other parts of the body, including the lymph nodes, spleen, liver, bone marrow. Pneumocystis infections can also affect the skin. It can cause small red or skin-colored bumps. They do not cause pain. Skin erosion or ulcerations may happen. The ear and armpit are the most common sites of pneumocystis skin infections. Causes. PCP and other pneumocystis infections happen in people with weakened immune systems. An adult's immune system can be weakened by chemotherapy treatment, chronic lung diseases, HIV, AIDS, long-term use of certain steroids, lupus, organ or bone marrow transplant, severe malnutrition. An infant's immune system can be weakened by being born early. It can also be weakened by malnourishment. Before the beginning of the HIV/AIDS epidemic in the 1980s, PCP was very rare. In fact, cases of PCP were one of the first signs that the epidemic was beginning. PCP soon became one of the main AIDS-defining illnesses in HIV-infected patients in the United States. It once was the #1 cause of death for people with HIV and AIDS, but now it is possible to prevent or treat most cases.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms of PCP. Some healthy adults carry the fungus in their lungs and never develop symptoms of PCP. But if a person's immune system stops working normally, the fungus can start causing symptoms. The first signs of PCP are difficulty breathing, even when resting, dry cough, fatigue, fever, tiredness. Symptoms of PCP in people with HIV usually happen gradually over weeks or months. PCP causes a low fever in people with HIV. In people who are not infected with HIV, symptoms are usually more severe. They often happen quickly with a high fever. Without treatment, PCP can be life-threatening. It can cause respiratory failure and lead to death. People with PCP need early and effective treatment. Diagnosis. To diagnose PCP, your healthcare provider will first perform a physical exam. He or she will ask you questions about your medical history and your symptoms. An X-ray of your chest may cause your healthcare provider to suspect PCP. A sample of sputum may be tested to confirm the diagnosis. Sputum is a thick fluid made in the lungs and in the airways leading to the lungs. The sputum will be examined under a microscope. Tests may be performed on the sputum. If it contains the fungi that cause PCP, you will be diagnosed with the infection. Your healthcare provider may collect the sputum through the following methods: induced sputum, bronchoalveolar lavage, lung biopsy. To induce sputum, you will inhale a salty mist. The mist will cause you to cough deeply. You will cough up the sputum into a cup. During a bronchoalveolar lavage, a small tube is passed through your mouth or nose. The tube goes into the lungs and fluid is squirted into a small area of lung. The fluid is then recollected for examination. A biopsy is the removal of cells or tissues for examination by a pathologist. During a lung biopsy, your healthcare provider will remove a small piece of lung tissue with a needle. The piece will be examined and tested for the fungi that cause PCP. To diagnose other types of pneumocystis infections, a biopsy of the infected tissue must be taken. The sample will be examined under a microscope for the fungi. Treatment. A pneumocystis infection can be fatal without treatment. To treat it, you must take antibiotics. Antibiotics can get rid of the infection. Antibiotics that treat pneumocystis are usually given orally or through a vein. Take all of your prescribed antibiotics. Do not stop taking them just because you feel better. If you stop them too soon, it could cause the infection to come back. This can make it much harder to treat. Patients with HIV tend to respond to medicines more slowly than patients without HIV. They may need longer treatment. Get plenty of rest and sleep. You may feel weak and tired for a while, but your energy level will improve with time. Drink plenty of fluids, enough so that your urine is light yellow or clear like water. Choose water and other caffeine-free clear liquids until you feel better. If you have kidney, heart, or liver disease and you have to limit fluids, talk with your healthcare provider before you increase the amount of fluids you drink. If coughing keeps you from resting or causes severe fatigue and chest wall pain, talk to your healthcare provider. He or she may suggest that you take a medicine to reduce the cough. Dry air makes coughing worse. You can use a humidifier to increase the moisture in the air. Do not smoke or allow others to smoke around you. Complications of PCP. The key to surviving PCP is early treatment. In patients with HIV infection, around 10 to 20% of cases will be fatal. In patients without HIV infection, about 30 to 50% of cases will be fatal. This is because patients with HIV are more closely monitored for PCP. Complications of untreated PCP are pleural effusion, pneumothorax, respiratory failure. Pleural effusion caused by PCP is very rare. Pleural effusion happens when too much fluid builds up in the thin sheet of tissue that wraps around the outside of your lungs. This can cause sharp chest pain and shortness of breath. If you develop pleural effusion, you may need to stay in a healthcare facility to have the fluid continuously drained. It will be drained through a tube inserted into your chest. Pneumothorax is a collapsed lung. It happens when air leaks into the space between your lungs and chest wall. This air pushes on the outside of your lung and makes it collapse. In most cases, only a part of the lung collapses. A small, uncomplicated pneumothorax may heal on its own. When the pneumothorax is larger, healthcare providers usually insert a tube or needle between your ribs to remove the excess air. Severe pneumothorax may cause heart failure, low blood oxygen levels, respiratory failure, or shock. Prevention of PCP. There is no vaccine to prevent PCP, but an antibiotic called TMP-SMX can be given to people at high risk of developing PCP to stop the illness from happening. If your healthcare provider thinks you are at risk for developing PCP, he or she might prescribe this medicine for you. TMP-SMX prophylaxis is currently recommended for all HIV/AIDS patients who have CD4 or T-cell counts below 200, infants born to HIV-infected mothers, people with a history of PCP, organ, bone marrow, and stem cell transplant patients, people who take long-term high-dose corticosteroids.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pneumocystis infections are caused by a fungus. The fungus is known as Pneumocystis urivec. It lives in the lungs of many people. Most people's immune systems keep the fungus under control, but if your immune system is weak, the fungus can make you very sick. An adult's immune system can be weakened by chemotherapy treatment, chronic lung diseases, HIV, AIDS, long-term use of certain steroids, lupus, organ or bone marrow transplant, severe malnutrition. The first signs of PCP are difficulty breathing, even when resting, dry cough, fatigue, fever, tiredness. Without treatment, PCP can be life-threatening. It can cause respiratory failure and lead to death. People with PCP need early and effective treatment. To treat it, you must take antibiotics. Antibiotics can get rid of the infection.
Thank you for using Explain.